So thoracic outlet syndrome is a condition by which an area in your neck gets narrow. That thoracic outlet is composed of two big muscles deep in your neck called your scalene muscles, and then your first rib and your collarbone. And with either repetitive motion, such as throwing, pitching, swimming, even painting, typing, or working out, or a single traumatic event such as a car accident or fall can lead to an injury and buildup of scar tissue. And if that happens, then one of the three critical structures that run through the thoracic outlet, either the artery that supplies the blood to your hand and arm, the vein that drains the blood from your arm and hand, or all the nerves that supply the muscles to your arm and hand can get smushed. And if they do, patients can present with varying kinds of symptoms from numbness and tingling, weakness, cold, or severe swelling, and worse, even a blood clot in the veins of your upper extremity. And if any of those sorts of conditions happen, it does typically require careful and critical diagnosis and urgent intervention. Many times, people with thoracic outlet syndrome get misdiagnosed with shoulder issues such as rotator cuff problems or cervical spine issues, and some even undergo procedures to treat their shoulder or cervical spine and unfortunately don't recover because the problem is always thoracic outlet syndrome. Many patients have similar symptoms to thoracic outlet syndrome, and it could actually be a shoulder problem or a cervical spine problem. It could be carpal tunnel, and there's varying ways to arrive at the diagnosis. One of the tests that's very diagnostic of thoracic outlet syndrome would be a dynamic ultrasound that looks at compression of the arteries and the veins with and without varying arm movements. To diagnose thoracic outlet syndrome involving the brachial plexus, it's sometimes a little difficult because many times CAT scans or MRIs of the brachial plexus tend to be unremarkable and EMGs are normal. We never want EMGs, which is a nerve conduction study test, to ever get to be abnormal, because if they are, that means the nerves and the muscles are much more damage than we would hope, and that would predict not as great a recovery as it could be. One of the key things is both patients and providers have to have a high index of suspicion to think about this diagnosis, especially when patients have sort of varying symptoms of numbness and tingling and coldness, especially with certain positions. Patients are fairly athletic and high functioning, do some of these repetitive activities such as working out or typing or painting or swimming, and or might have had some sort of traumatic injury at some point in their earlier life. Once a diagnosis of thoracic outlet syndrome is made, patients can undergo physical therapy. However, many times physical therapy alone isn't adequate to alleviate all the symptoms, and a thoracic outlet decompression is necessary. That typically requires a 2-inch incision above your collarbone on whichever affected side, and then I clean out all the scar tissue around the nerves, the artery, and the vein. I resect portions of those two deep muscles, your scalene muscles. They're not functional muscles, so patients have no significant recovery related to that. And then I take out a piece of the rib and decompress that space. Patients typically spend one night in the hospital, go home the next day. They are doing activities of their normal life immediately, including brushing your hair. There's no sling involved. The only real restriction for the first couple weeks is nothing really heavy lifting more than about 10 or 15 pounds. But after about 2 weeks, patients start physical therapy, and within 6 weeks, if you're a pitcher, you go back to throwing or swimming, and within 3 months, you're back to normal.